on this episode of The Natural Plastic Surgeon. Wait, they had no after photos?
No.
Okay, like you're not getting a good vibe.
Right.
And you're not feeling like they're like identifying what it is that you're trying to achieve, you know? So,
exactly. The people that wouldn't show me the pictures,
yeah,
they actually looked you up.
They looked me up.
They looked you up.
Okay.
To make sure that you were a good doctor to come see and you were certified.
We taught you how to tape your incisions.
Yes.
Okay, so you're going to do that for the next 4 weeks.
Right.
Okay. We're going to check in 4 weeks and make sure that you're healing appropriately. Make sure you don't have any spitting sutures or anything like that. You navigated this like a boss. You know, this is just like a huge operation. Like, I'll cut you in half.
Yeah.
Cut you in half, and we did the breast lift, the fat transfer, the lipo, and you just look phenomenal. It's great.
Thank you.
Yeah.
I'm always laughing, and I feel like I'm gonna bust open my stitches.
Laughing isn't going to bust open your stitches. Yeah.
Yeah.
Yeah, but it hurts sometimes.
Yeah.
So
it hurt a lot. So
yeah.
it's like, stop.
Hey everyone, it's Dr. Barrett. We're here at the Natural Plastic Surgeon podcast, and we have a special guest, a patient of mine, Holly, who is 2 weeks out from an amazing operation.
Yes.
Welcome, Holly.
Thank you.
How are you feeling?
I feel pretty good.
All right. I want to tell the viewers what surgery you had done.
Okay.
Okay. So let's go through it. Now, you're 37. You have 2 children.
Yes.
And we did a combination of procedures a lot of people call a mommy makeover, but we added a few extra things on it. So we did.
Yes, we did.
Yes. So we did a tummy tuck.
Yep.
We did liposuction of the abdomen and the flanks.
Yes.
Okay. We also did liposuction of your arms and your neck.
Yes.
Okay. And now for the breasts, we did a fat transfer to the breasts
Yes.
as well, and a lift.
Yep.
Okay. Au naturel. And we just did our post-op exam, and you look amazing.
Thank you.
Yeah, we got your last set of stitches out, and you're only 2 weeks, but it's all starting to come together.
Yes.
How do you feel?
I'm excited. I'm glad that it's done, but I'm eager to see what the outcome is going to be when I'm fully healed and everything's done and over with. So I'm happy and I feel good.
Right. Well, so the reason why we have you on here is even though it's 2 weeks, you're not going to see your final result until about 6 months. Right. So we know that. We know about 6 weeks is going to look good. Right now, we're still a lot of swelling and a lot of bruising and all that other stuff.
Yes.
So the reason why we have you on here is because you are out of town patient. Where do you live?
Denver,
Colorado, and you came all the way out here to Beverly Hills.
I did.
To get this magnificent operation done. So I want to kind of dive into that a little bit. When did you start this process, and how did you find me?
So I've been thinking about it for a while, and I've been looking because if I wanted to do it, I didn't want any horror stories or anything like that. I mean, it's a big commitment to do. And so I've seen a lot of your videos, and scarring was important to me. I didn't want to have, noticeable scars or, anything like that. And I've seen enough of your videos where it's like, okay, I think if I'm going to do it, I wanted you to do it. Yeah. So you kind of made me do the leap into it.
So you found me online, basically.
Yeah.
Watched some videos, and you're like, this is the guy. Now, did you try to look in Denver at all?
I did.
Okay.
I did.
Did you go on any consultations?
I did. I went to 2. One of them, they couldn't give me any after pictures, which I wasn't okay with.
Wait, they had no after photos?
No, because of HIPAA laws, so they couldn't show me their after pictures.
Okay.
So that kind of scared me a little bit. And
well,
then,
see, HIPAA does exist, but patients can give permission to show their photos.
Right.
Yeah, for like before and afters and so forth.
Yeah.
And I'm surprised not like one patient had given permission.
No.
That's kind of scary.
Yeah. So I was like, okay, that's not okay with me. And, the price was, okay. It was, a good price, but I need photos and I need to see the aftermath of everything. And that was kind of one of my determining factors. So, yeah.
So there was another one though you went to.
Yes.
Did they have before and afters?
They did.
Okay.
And they were okay. It wasn't really, I just still didn't feel I really wanted to go to them. I think I had my mind set on coming here and coming to you.
Yeah.
Basically. And your work compared to theirs was very different. So
Well, that's awesome. I mean, when I get permission, I do put before and afters out there. I do a lot of surgery, so I have a lot of them. But that's kind of important. You got to do your basics, right? I always talk about it's like a pyramid of what you need to look for in a plastic surgeon. The
Right.
base is like, are they a real doctor?
Yes, yes.
Are they a real plastic surgeon? Are they board certified? Do they do this kind of procedure? What does their results look like? And at the very
Hmm.
top, is it a good fit?
Exactly. Yeah.
Do I
Yeah.
kind of like, is this doc getting my vibe? They could be
Yeah.
great, do awesome work, but like you're not getting a good vibe, right?
Right.
And you're not feeling like they're like identifying what it is that you're trying to achieve. So
Exactly.
to me, I'm always into, natural looking results. I don't want to look like you've had plastic surgery. I want to minimize your scarring, all that good stuff. And
Right.
so I spent a lot of time doing that.
Yeah, and that was so important to me because really what I've lost 60 pounds since March, and that was
Yeah.
like my commitment. I was like, okay, I'm going to do this. I'm going to do it big and,
Yeah. Wait a
lose this
second.
much
You
weight.
lost 60 pounds since March.
Yeah,
I
to
knew you
have the
lost weight, but I
surgery.
didn't know it was this fast.
Yeah.
How did you do it? I know some of the listeners want to know this because there's a lot of people out there. They're
Mm-hmm.
like we're in your shoes, are in your shoes,
Yeah.
and they're struggling because, it's like you don't want to get plastic surgery until you kind of hit your goal weight, right? Because
Right.
if you get it done and then it's like going to the tailor and then you lose 10 pounds, you got to get your clothes fit again,
Yeah,
right? So
exactly.
tell me about that.
So it wasn't easy. It
Mhm.
was, strict diet, strict healthy eating and
Okay.
exercising
So tell me
and
about the diet. Is there a specific one that you use?
no, there really wasn't. I
Mhm.
just ate natural and healthy and no takeout and,
Yep.
really no alcohol,
Yeah.
which,
You'll be surprised how many calories like having a couple drinks
I know. Well, and
can do.
Starbucks too.
Yeah. Well, yeah. So it's like people are like, oh, I'm just having a cup of coffee. And then they have
Yeah.
like, it's like this mocha frappuccino
Yeah.
with whipped cream on top. And like, this is like 1,000 calorie drink.
It is. It
Yeah.
is. If you really look at it,
Mhm.
it's a lot. So I cut all that out, and
Yeah.
it just started coming, and working out, twice a day sometimes.
Twice a day.
Sometimes, yeah, in the
That's
morning and at
that's
night.
badass.
Yeah,
I
yeah.
love to hear that.
Well, when I set my mind to something, it's like I'm gonna do it.
Right.
You have to have the commitment because it was, why come here
Right.
to not really have
You
that,
need to go all in.
Mm-hmm.
You're spending this kind of money, this much time, you want to do it right.
Exactly.
Yeah. And I tell people that too. It's like you really got to space, we only get one body. If you go out to buy a car and you don't like the seats, you don't like the the fuel economy or whatever it is you don't like about the car, you can always trade it in, right?
Right.
You
Yes.
can't do that for your body.
You can't.
If you mess up, it's like this is the only shot I get unless you believe in reincarnation. But that's it's not at
Either
least
way.
here now. So
Yeah.
it's like you gotta really do your research and do your homework. It's not
You
something you
do.
want to take lightly.
Yeah.
Yeah.
Well, to tell you something funny about the people that wouldn't show me the pictures,
Yeah.
they actually looked you up
They
to
looked
make
me
sure
up.
they looked you up
Okay.
to make sure that you were a good doctor to come see and you were
Yeah.
certified. So
Oh,
it was
cool.
kind of funny.
So they look me. Yeah. So by the way, that's a really good point. You can actually go to the American Board of Plastic Surgery
Mhm.
and look up plastic surgeons by their name and see if they're board certified.
Yeah. Yeah.
So that's great that they did that, but you could have done that too. Anybody
Yeah.
can.
Oh, I did. I did.
Okay.
But I just thought it was kind of funny because they wouldn't show me pictures, but
Yeah.
then they were still looking you up to make sure that you were okay. So I thought
Yeah.
it was kind of funny.
That's great. So you know what? We'll put in our show notes. We'll put in the American Board of Plastic Surgery website so that you can actually, all your listeners out there or viewers, you can actually look us up. Look up a plastic surgeon that if you don't want to come out here, you don't want to look me up. I'm board certified. You don't have to look me up, but if you want, go ahead. But if there's a plastic surgeon that you want to actually look up, then go to this website. We'll put it in the show notes so that you can check it out yourself.
Mhm.
Yeah. All right. So you come out. Wait, no, we do a Skype consult.
Yeah.
Okay.
Yeah.
So you talk to Rachel. We set up a Skype consult, and this is something where I actually get photos,
Right.
which is really helpful. You took a lot of good photos from different angles.
Yeah.
Did you take those yourself, or did you have
I
somebody?
did.
Okay, so that's pretty creative. Like somehow you had like a mirror there,
Yeah.
and so but I could see everything that we had.
Yeah.
And then we brought up the photos during the Skype consult. We spent about 45 minutes doing that, just to make sure that we're on the same page before you fly all the way out here
Right.
and commit to this.
Yes.
So good. How did you feel at the end of the Skype consult?
I felt good.
Yeah.
I felt like everything, I was on the way to the right doctor, and I felt
Okay.
everything was, pretty simple, and I didn't have like a lot of fear on wow, did I just really make a mistake? Or,
Good.
yeah, I felt comfortable. I felt really good about everything. It was, and the girls, they're so great. You
Yeah.
have a really amazing staff. So
That's great. I tell everybody is like, we're really all here for the patients.
Right.
That's our number. We had a team meeting this morning and we said, what our number one goal is to make a better experience for each and every person. And each and every person, this is their first time, most of the time, first time getting surgery. Sometimes we get repeat people, and hopefully that'll be you if you want additional stuff. But for the most time, this is their first time going through the surgery.
Right.
And so you got to really kind of roll out the red carpet. This is a really scary thing. It takes literally very little to spook somebody away from considering plastic surgery.
Yes.
And it's my passion in life. I love it. I love making people feel better about their bodies and feel good. And we make sure we have the same mentality in our entire team,
Right.
that if we focus on this first, everything else will fall into place.
Yes.
So I'm glad to hear that you got that same
I
experience.
did.
Yeah.
They were all amazing. They made me so comfortable because I'm the type that if I don't have to have surgery, I don't want it,
Right.
And so
Nobody
I was
really
like,
wants to have surgery.
No
It's
one.
like we're by the way, we're in the operating room
Yeah.
that you had your surgery in.
Oh, are we?
Yes.
Oh, I think I was so nervous. I was
Welcome
like,
back. I know
yes.
most people are. They're super nervous, and they're always nervous about anesthesia. Anesthesia is safe. It's routine in some sense for me. I get excited about each and individual person. Customize every operation based on the person, and I kind of get stoked the night before where I review the charts and get ready for the surgeries. But I do, it's my job.
Yeah.
And I try to put myself into your shoes, and that's why we have anesthesiologists that are really good.
Yeah.
They really relax you. And how did you feel about the anesthesia?
Oh my God, he was amazing.
Yeah.
I mean, he really, because I had, some family history that it made me a little bit more concerned and,
Right.
Scared for the surgery.
Mm-hmm.
But he took the time to really go over my concerns of the health issues and everything. And
What were those
sure.
health issues again?
My dad had passed away in March, and he had stem cell therapy, and he had like an embolism. So it was
when he was having the stem cell therapy.
after. Yeah, like 3 days after.
He had. Where was he getting the stem cell therapy for?
Somebody from Seattle, and that's why it was so important because we're finding out that they might not have been certified. And
But what was he trying to treat with the stem cells?
he was diagnosed with ACL or ALS. Sorry.
Okay, so it's like Lou Gehrig's disease, and okay, that's a really difficult disease.
It is.
How far was he along with that?
This would have been his second year.
Okay. So
After
he was seeing
diagnosis.
symptoms and stuff like
Yeah.
that? Okay.
Already had seen symptoms. And that was one of the things that was really kind of, terrifying for me because here he had this procedure done.
Right.
And then 3 days later, he was no longer here.
Yeah.
So,
gosh, so fast.
Yeah, it was kind of terrifying to me. So I really talked to him about it. And, I have some blood traits that I guess aren't really important. But to me, I didn't know that, you know. So he really took the time to talk to me and see, what my concerns were, make sure it wasn't an issue. And, it was just he was really great.
Yeah.
So
good.
Made me very comfortable.
Good.
Yeah.
That's exactly what we want. We want the process to be easy from your wait time to, getting you exactly the results that you want, making it pain-free, making your recovery quick. I mean, the fact that you're here sitting in a chair, is just phenomenal.
Yeah.
You've navigated this like a boss. This is just like a huge operation. Like I'll cut you in half.
Yeah.
Cut you in half, and we did the breast lift, the fat transfer, the lipo, and you just look phenomenal. It's great.
Thank you.
Yeah.
Thank you. My family still can't believe I actually did it.
Really?
Yeah, they thought I was going to get here and totally not do it. So,
Well, it's kind of tough once you come all the way out here. It's just, although there's fun stuff to do in Los Angeles. If you don't want to do surgery, there's plenty of fun stuff to do.
Yeah.
But all right, so I want to get into some questions that we've. Some of these are actually from some listeners and some of our social following. Where did you stay?
So we've actually stayed at a few different places.
Okay.
But we've really just got apartments.
Okay. So you did like an Airbnb?
Yeah.
Okay.
Yeah.
And that worked out for you?
Yeah, it was amazing. Pretty easy.
And who did you travel with?
Delta.
Okay. for your flight.
For a flight.
But did you travel with anybody and like who's here with you?
Family.
Yeah.
So my husband came with me and my daughter.
Okay.
And then we've been here for 3 weeks.
That's fun.
Yeah. So
did you guys have a good time while you're out here?
For the most part, yeah. Yeah.
Do anything fun?
I don't know, not yet, because I've been recovering.
I know. They didn't like leave you like, hey, we're going to Disneyland?
My daughter did.
She did?
She did.
Okay.
She went to Disneyland, but she was only here, with my son for like 3 days. So I gave him a pass.
Got it.
But me and my husband are here now for our last week.
Yeah.
And we're gonna hopefully do some fun things. So I'll let you know.
Okay. So wait, so when are you leaving?
Friday
of this week.
Yeah.
Okay, so it's Monday. So now you're kind of mobile. You can kind of go check out some stuff. You got the week, and so overall, how long have you been out here for? Would you say
2 weeks? Yeah.
All right, you've been out here for 2 weeks, and then but you've got a few more days left. So you say total time is about 3 weeks.
Yep.
Okay. Was that enough time?
Oh, definitely.
Okay.
Yeah, it was definitely, I think I overdid it, but if I was going to do it, I haven't had a vacation in a while, so.
Right. You healed like a champ. And so some people do require more time. So giving yourself 3 weeks out here is totally fine.
Yeah.
I think 2 weeks is a good amount of time for this big of an operation. So anytime you're thinking about a tummy tuck, 2 weeks. If you think about breasts, I always tell people maybe about a week, and then maybe come back, fly back for your like a second post-op visit if you can, or we could do it on Skype. But the important thing from this point, you're at your 2 weeks, all your stitches are out. Most of the major stuff is done, but we've taught you some things to do at home, right?
Right.
We taught you how to tape your incisions.
Yes.
Okay, so you're going to do that for the next 4 weeks.
Right.
Okay, we're going to check in 4 weeks and make sure that you're healing appropriately. Make sure you don't have any spitting sutures or anything like that. I always tell people to prepare, like, hey, there might be a chance that I still have to fly out for something that happens.
Yeah.
Which can happen. Fortunately, a flight from Denver here is not so bad. But if you were like in Thailand or if you were in Australia coming out here, that's a big deal.
Yeah.
So those are some things you want to consider. But for your situation, you've just been flawless. Everything's been flawless for you.
Thank you.
That's great.
Yeah, it has.
Good.
It's been pretty good.
Okay. So what information did we provide to you about coming out here? Did we give you anything? Did we give you a website link or how?
You guys actually gave me hotel options. You gave me. I was kind of above and beyond with questions. I swear I was calling you guys every other day up until my surgery with new questions, but I wanted to be prepared and I wanted to make sure I had everything, even my post-op stuff you guys were giving me before because I was asking for it. So
good.
You guys gave me a lot of information. Whatever I wanted, you guys provided for me. So it was pretty good.
Okay. And in terms of your preparation, is there anything you did in particular to prepare?
Just the weight loss.
Yeah.
That was pretty much.
The twice a day. Love it.
Yeah. Yeah. I know. I can't wait to do that again because I'm like, ugh.
I know. We'll get you there.
Yeah.
And it's going to look even better.
Yes.
So day of surgery arrives. How did you feel that morning?
It was kind of weird. I felt really calm, and I'm usually not that calm. I'm usually real. I remember talking to you about anxiety and being nervous, and I was pretty calm and mellow. And
you were.
I just remember saying you guys tricked me because I was talking.
Yeah.
And then all of a sudden I was waking up. So it was really great.
Well, once you start, but so when they start an IV, there's ways to induce people for anesthesia. When they start an IV, and then there's gas. Normally we don't induce with the gas. So the little mask is actually just oxygen. When we tell you it's oxygen, but what's probably going in your IV is a little bit of stuff that just relaxes you.
Yeah.
And that's what probably makes you kind of doze off.
Yeah.
It's really comfortable.
It was really nice.
Yeah.
It was no anxious, no anything. I didn't wake up anxious, just, thirsty, but that was pretty much it. It was really peaceful, actually.
Now, I think, did you get the long-acting pain medication?
I did.
Okay, so that's called Exparel. That's really important in terms of postoperative pain control. It lasts for 3 days.
Yeah.
So tell us about your postoperative experience. You went somewhere, right?
I did. I went to Serenity for 3 days. And it was pretty good. It was, just, I think, knowing that they could take care of me if anything happened or if there was, a medical emergency or whatever was, peace of mind,
Totally.
Yeah.
These nurses are fantastic.
Mm-hmm.
The food is fantastic.
Yeah.
The accommodations, you feel like you're at a luxury hotel. I actually called a nurse that night. I don't know if you know this.
No.
But yeah. So I called in and she told me everything about you and how much was coming out of your drains and all this other stuff. So
Aw.
I always call and check on my patients there. I actually had another patient there the same time as you.
Oh, did you?
Yeah. So it was I was filling up the ward there, but that's great. It's really important to have with this major of an operation. You know,
Yeah.
when I say it's more than one area, like tummy and breast, Serenity,
Right.
aftercare, right? If it's just maybe one thing, maybe we can get away with a hotel or something like that. But you know, when you're in a strange and new environment, you kind of want to have that dedicated professional kind of keeping tabs on you, which I think is
Yeah.
really important.
Yeah, I think it makes it easier for you to just heal,
Yeah.
you know, and worry
And-
about healing.
Yeah, and you get all these tips, right? How do I milk my drains? How do I record the output? How am I supposed to shower?
Yeah.
Like, what do I do with these drains when I'm showering? You know, all those things that
Exactly.
kind of get you through it that first day, maybe the
Yeah.
second day. You were there for 2 nights?
3 nights.
3 nights?
Yeah.
What a luxury.
I was going to take it all in.
Yeah. They get you up, they walk around, prevent blood clots, all that stuff.
Yeah.
Did you give you leg squeezers too?
No, they didn't do
okay.
that. But
Probably you weren't at high risk for that, so that's fine for
Yeah.
blood clots. So, okay, and then you come back in for your post-op week 1 and then week 2, which was today. So, how did you feel week 1 versus today?
I feel great today. I mean,
okay.
even week 1, I mean, I still felt pretty good, but
Yeah.
I was, you know, I had those drain bags. That was
I
the
know.
worst out of this whole experience.
Tell me about that.
God, I hate those things.
Why? Because they're just an inconvenience? Are they painful?
Sometimes if you move the wrong way, they're a little painful because
Yeah.
they can snag and then
Yeah.
it like pulls, you know. But I think it's just inconvenience.
Okay.
You know, having to carry these things that are visible to everyone is kind of obnoxious, but you know, I get
Yeah.
why it's there,
Yeah.
you know. But if that's the worst out of all of this, it's okay.
Yeah, that's really a great way to look at it because there's
Yeah.
a lot of things going to happen with these operations. You
Yeah.
can get infection, you can get wound breakdown, you get
Yes.
skin necrosis. I've had a couple of those things happen, and it's just really it's really challenging. And so a lot of people forget that. You know, they're like, oh, these drains are so annoying, but
Yeah.
it's like if you really think about it, if that's the only thing you have to complain about,
Okay.
you're doing pretty
Yeah.
good.
Yeah, we're okay. You know,
Yeah.
and the outcome of those 2 drains, I'm okay with it.
Yeah.
So
Awesome.
that's all right.
So tell me, if you could go back and do it all over again, would you do it?
Okay, so I've been asked that about 10 times in the
Yeah.
last 3 days.
Oh, really?
Yeah,
Who asked you
my
that?
family,
Yeah.
everyone, and
Okay.
her work, and
Uh-huh.
my husband, like every day.
He says,
He does, and I go, I'll tell you in 4 months.
okay.
So, you know, but for the most part, I know my outcome of what I want, and you know, I mean, I didn't want to be like superficial. Obviously, I went as natural as I could on everything, you know, and
Yeah.
but my main thing was when I work out, not being able to feel my stomach muscles has been like one of my biggest problems. So,
Tell me about that.
you know, that's really what started this
Mhm.
was, you know, I was working out, like I said, you know,
Mhm.
a lot and not feeling that core strength,
Mhm.
you know, and that really bugged me.
Yeah.
And that was like, okay, but if I'm going to do it, I might as well get, you know, this done too.
Right.
Make it count, right?
Yeah, exactly. I mean, it's a mommy makeover and doing the breasts and the fact that we're able to do fat transfer to your breasts is really awesome because we
Yeah.
don't have to deal with an implant. You know,
Yeah.
I use implants all the time, but there's a maintenance associated with it. You have to get them swapped out every 10 years. And
Right.
you had really good breast tissue and
Yeah.
you got that beautiful lift. And we did that fat transfer. We transferred approximately 500 cc's per breast. A little more on the right actually, and
Yeah.
then a little less on the left. We took off about 1150 cc's from each flank, 350 from the abdomen, 300 from each arm, and 200 from the neck for a total of 3,400 cc's.
Wow.
Yeah. So that's,
So I have more to give.
yeah. But, then we took the best of that fat, and that's what we used to transfer the breast.
Yeah.
And it's one of my favorite things to do. Take spare parts where you don't want it and put it where you do want it.
Exactly.
Yeah.
Yeah. You know, and that was one of the things I kept going back and forth. Did I want a fat transfer or did I want an implant? Did I want a fat transfer?
Yeah.
You know, but like I said, I wanted to be as natural as I could. I just wanted to get, you know, a little pick me up here and there. So
Well, you totally got a little pick me up.
yes.
Yeah.
So that was, you know, what I did.
Good. what was your biggest fear throughout this whole process? I know you're not fully done, right? And you're doing great. We're going to, knock on wood. You're doing great. But what was your biggest fear about coming all the way out here and getting this done?
It was really just going under.
Under?
Yeah.
Okay.
That was honestly, the biggest concern. Obviously, like I said, I just had, that anxiety already, built up. And, but even that was really minimal once I got here and talked to everyone and, started, really the countdown, and kind of just became not really an issue.
So one of the things that helped you said, was talking to everyone. Was there anything else that you did that kind of helped calm your nerves before you came out?
No, I kind of tried not to think about it.
Okay.
Because I had already done all that before, when I was doing my research and everything. And once I set my mind to it and I was like, okay, I'm doing it. Yeah. So I kind of tried to not really think so much because I can overthink it too.
Right.
And I didn't want to do that. So I just prepared as much as I could for the surgery. And, that was pretty much it.
Let's talk about preparation. Is there anything, these things are learning experiences. Your first time, Right. Is there anything that you kind of learned that you think is a really good tip for someone thinking about doing this, coming out here or getting the surgery in general? That you're like, oh, I didn't know that's going to happen. Or
the compression socks. I learned how to put those on easier.
Yeah.
But really how to get up off the bed.
Okay.
I did, because that was kind of painful. I'm short.
Yeah.
So the bed's being taller and trying to move when you're like split open was kind of painful for a little bit. But
just so you know, there's 4 layers of sutures. You're not going to open up, and stay strips.
You know, and I did that too. I was like, all of a sudden, my husband's funny to me, and I'm always laughing, and I feel like I'm gonna bust open my stitches.
Laughing isn't going to bust open your stitches. Yeah.
Yeah.
Yeah, but it hurts sometimes.
Yeah, so it hurt a lot. So I was like, stop.
But when you do that, it's almost like it makes you laugh more.
It does.
Yeah.
Right.
Which is horrible. Yeah. Wonderful. What other advice can you give to somebody who's thinking about traveling? Because it's like we want to check in. It's nothing like doing in-person check-ins. I love to do that, but it's just like, if you can find a local person, but if people can't find a local surgeon, like what should they do? Like, what's your advice to that person that is like, I went to this consult, I don't feel great about it. Like, what do you do?
Yeah, if you don't feel great or that connection, don't do it, because usually your first instinct is the right one.
Yeah.
And I mean, it would have been a lot cheaper for me to do in Colorado.
Yeah.
I mean, that's obvious, but I just didn't feel like they understood what I was wanting, because I wanted to be, like I said, as natural as I could and do, I didn't want to come here looking like I came to Beverly Hills for plastic surgery,
Yeah.
But I also wanted to make sure that I didn't have visible scars. That was so important to me. And just seeing your, after it, I felt comfortable.
Yeah, you're healing really nicely. And for people who don't know this, I close my breast incisions in 5 layers. I close the tummy incisions in 4 layers. Spend a lot of time on the belly button. We do taping. We do scar management. We got you in compression already.
Yep, in compression today.
Yep.
Yeah.
And we'll keep an eye on your belly button. Sometimes we'll start a belly button silicone sphere.
Yeah.
I don't think you needed that today, but when we check in at 6 weeks, we'll look at the belly button and see if it starts to get a little bit small, then we want to put that little silicone sphere in there.
Okay.
But we can send that out to you if you need it. Really, I use a product called Skinuva. I've talked about it at a previous podcast. I'm not sure what episode. We'll put that in the show notes. The Skinuva Scar Gel that I recommend for all my patients. It has silicone scar gel. It also has a bunch of growth factors in it and vitamin C and some other lightening agents that kind of help with the hyperpigmentation that happens with it. And I've done a lot of research on scar management, and it's like the best. I was like, if I was going to get incision, what would I put? What would I do? And so these are all the things that I've been able to come up with research and trying to get the best healing as possible, because people really care about scars.
Oh, yeah.
It's like, it's amazing that there's so many other plastic surgeons and other surgeons, like orthopedic surgeons, that are using, like, not to knock them, there's a lot of surgeons that use staples. I'm like,
really?
Yeah, it's just staples. Come on like a young woman's knee. I'm like, what are you doing? It's going to be a big scar there.
Yeah.
So that's one of my goals. And I don't know if it's a pet peeve or just a passion, because it's just it's such a big deal to minimize scars.
Yeah. Believe me, those staple or the stitches, oh my God, those blue ones are friggin' painful.
Yes.
They are so painful, but
they're out.
They're out.
They're out.
And like I told her, I was like, God, if this is all I have to deal with, it's okay.
Yeah, but the theory behind why we use those blue proline sutures, they held the strength for the 2 weeks, right? But then their job is done, and you want them out of your body. Because if you were to use an absorbable suture in that situation, that your body has to absorb that. Even though it's no longer holding tension anymore, your body has to absorb it, and it creates inflammation to break that suture down.
Oh.
So that's why in the skin, I use non-absorbable sutures.
But that's okay.
Yeah.
I really like the fact that you do use so many layers, because like I said, all of a sudden I'm laughing when I really shouldn't be. So I'd hate for everything to like fall apart because I'm laughing.
Exactly.
So it's okay. They need to do their job. And
I don't know whether it was based on my training or what, or just personal beliefs, but I remember when I was back in USC doing general surgery training, there was this one patient who sneezed, and he had an abdominal operation, and his tummy opened up.
Oh my God.
It was not a tummy tuck. It was another type of bowel operation, and his tummy opened. So I get a call from a nurse at 2 a.m. Hey doc, you should come take a look. I go by, and he's got
oh my God, that's
intestine
awful.
hanging out. So I'm just like, we got to do a better job.
That is awful.
I know, it is awful. And he did okay. We brought it back to surgery at 4:00 in the morning, and we closed everything up. But I did not close his incision. I was just happened to be on call that night, and I saw him. And it's just, I was like, I'm never going to have any of my incisions open up. So I closed in so many layers. You know? So the application in 2 layers on the inside, and then your skin in 4 layers.
Yeah. See, and that's amazing. Like I told him, I was like, it's painful, but I can feel those muscles, and that's really what I wanted. That's what started.
Do you feel them now?
Oh yes.
Yeah.
Yes, and I love
great.
it. I'm so excited for that.
A lot of people don't know that. Part of the tummy tuck is that plication to bring those muscles together, makes the tummy flat, brings in the waist, and strengthens your core.
Yes.
Which is awesome.
I'm so excited for that. I think that's like, I can't wait till I could work out again.
I feel like your posture is already better.
It is.
Yeah. I mean, you just look so like tone and
thank you.
Strong.
Thank you.
Good. Well, Holly, it was a pleasure having you on here. Anything else you want to share about your experience to potential, at least, most of our listeners are people that are thinking about having surgery or maybe have already had it, but mostly they're thinking about, maybe this could be an out-of-town person or someone who's considering a mommy makeover or fat transfer to breast. Is there anything that you want to share about your experience?
Just if it's something you really want to do and it hasn't gone away and you keep, maybe I do, maybe I don't. You don't have to be super artificial, to get the results that you want, and go for it. Just do it.
Just do it.
Just do it.
Love it. You only live once.
Yep. And you can find 100 reasons not to do it.
Yeah.
So you just got to find those 10 to do it and do it.
Absolutely.
Yeah.
So Holly, we're going to check in. I want to check in like 6 months, and I want to get the final recap from you. You know? Yeah. We'll have to throw that in as like an update and be like, how is Holly doing? I know you're going to do amazing because you're such an incredible person.
Thank you. You too. I just love it. You guys have been great. And I'm kind of sad to go home because, no, I can't come and tell you guys everything I've been doing.
You sure you can? Share it with us. Do you have social media?
I do.
Okay. So tag us, Dr. Daniel Barrett, and tag us. That's my favorite thing to do is I'll pull up my social. I'll check out people that have tagged me and like all the new stuff that you're doing, how you're looking, because it's going to be a little while before the beach season.
Yeah.
But I want to see how you're doing, because that honestly is what lights my fire every day, is seeing my post-op patients and seeing you out enjoying your life and feeling better about your body.
Yeah, definitely. And I already do. Good. So thank you.
You're welcome, Holly. Thanks for being on the show today.
Thank you.
Okay.